Hey friends! I'd promised that I was going to do a video on like my birth plan choices and like why I chose these things, etc. So this is that video. I'm sorry in advance for the background noise. My husband decided to start a 3D print right before I started recording, so that's going in the background. And also Kiddo is right next to me. Wow, my hair looks wacko. Kiddo's right next to me blasting his bubble guppies in my ear, and so presumably into yours as well. It's chaos, but we're going to try our best to make it work regardless. So I have my little worksheet here. This is the worksheet that the doula sent me, and some of it is kind of repetitive, but I'm going to go over it as much as I'm able without necessarily like going into the repetitive stuff, and offer details, I guess, where I'm able. So it starts out with my name, my husband's name, and our due date, because that's important. And then the next section, the first section, is called atmosphere. So it's basically a checklist, and what we did is that she had me fill out this checklist before we met, or before we had a meeting rather, because we'd already met. And we went over the things I chose on the checklist and why I wanted those things, to see if she could offer me alternatives as well, or to see if like I fully understood what I was choosing or what I wasn't choosing, and like seeing if maybe that could also be beneficial. So in atmosphere, the categories you could pick from were quiet, music, dim lights, wear my own clothes, minimal interruptions, limited staff, so no students, limited cervical exams, let water break on its own, and then other, where you could write in whatever else you might have, you know, as far as a request. I did not select quiet, music, or dim lights. It's just stuff that hadn't occurred to me, and I don't know what the likelihood is that I'll get any of these things, considering I'm going to be in a hospital environment. I don't think they quite matter very much, although she did explain to me that dimmer lights are associated with better outcomes as far as labor progressing, which makes sense. As far as quieter music, that's just a preference thing. I did say that I wanted to wear my own clothes. I had my own laboring gown with my son, and I don't have one yet for my daughter, but I'm expecting to get one, so I will be wearing my own clothes. Minimal interruptions, limited staff. I don't want students in the room. I want as few people and as few interventions and as few things going on as possible. So random students coming in and asking questions is not my idea of a peaceful birth environment. Again, limited cervical exams, because I don't want to be interrupted or to be harassed while I'm trying to labor. Plus, I got a lot of cervical exams when I was in labor with my son, and I find that they're just really discouraging because I barely progressed with my son, and being reminded that I'd just gone through 6 hours of hard labor with Pitocin without an epidural, only to be told I'd progressed a ½ centimeter, that takes the wind out of your sails. So I'd rather not. Plus, it's a risk of infection every time they do it, so as minimal as possible. And then let water break on its own. Again, the more interventions you do, the likelier it is that you're going to have more interventions after. So I want as hands-off an approach as possible. The next one is pain management. Bath or shower, breathing techniques, massage, aromatherapy, hypnobirthing, movement, or other. I selected all of them except hypnobirthing. I do have a book on hypnobirthing, and I've read it, but I've not taken any classes or refreshers or reread the book, and so I'm not familiar enough with it as a technique at this point to say, yes, I definitely want to do that. Everything else sounds good to me, though. I'm open to whatever pain management techniques we can try. My doctor wants me to have an epidural, but that's one of the reasons why I want to be laboring at home as long as possible, is because once I get to the hospital, I'm probably going to get an epidural. And if you get an epidural, you can't move as freely. And movement equals progress. So I want to be able to move freely, be comfortable in my home, and progress as much as possible before I must go to the hospital, get an epidural, and just kind of lay there and let whatever happen. And I know that I can handle the laboring part, the pain part, because I did it with my son. Yeah, so as far as pain medication, which is the next segment, please don't offer. I might try IV pain meds, I might try an epidural, I might try a TENS machine, which is like a muscle tensing machine. I might try nitrous oxide or other. I don't know what my options are at this hospital. I'm not comfortable with nitrous. I don't want IV pain meds. I might try an epidural because that's what my doctor wants me to do. With my first birth, I put please don't offer because I wasn't expecting to do any pain medication whatsoever. And that's how it went until they told me I needed an emergency C-section. And obviously they don't do those without pain medication. My delivery is planned as a vaginal, a VBAC, a C-section, or a water birth. I selected VBAC. And then as far as the actual delivery, do I want to breathe baby down? Do I want to be coached to push? Do I want to use a mirror? No forceps or vacuum if possible. Tear naturally if possible. Feel baby's head crown. I did select that I wanted to breathe the baby down. No forceps or vacuum if possible. And if I must tear, let me do it on my own. I don't want an episiotomy because an episiotomy means they cut you rather than letting you tear to make more space. But the problem is that if they cut you, it's like if you cut a piece of paper, it's a lot easier to keep tearing beyond that, when potentially I might not have teared or torn at all. And if you tear, it's not a straight line down, it's typically a little bit jagged, and that means that there's a natural starting spot or stopping spot, as it were. A cut means it's going to want to keep going down into your butt, and we don't want that. I don't want, again, the least amount of intervention possible. Feeling baby's head crown, not high on my list of priorities. I said I'd be open to a mirror if they have one, but I don't need one, just because like it might be cool, but maybe I say, oh no, I don't want to see that. I might change my mind in the moment. And I don't want to be coached to push because there are studies that show that being told when to push rather than following your own instinct, you're likelier to tear that way, and it's not any better outcome for you or the baby. So for birthing positions, I selected every single one of them because again, I know that my options will be limited once I get the epidural, but before that, I want to be able to move in as many ways and as much as possible because movement helps you progress. So the options listed here are birth ball, squatting, on side, birth stool, in bed, standing, in the bath, or on all fours. All of the above. If I'm able to do any of them, I will do all of them. After delivery, when do we want to do the cord clamping? I put when the cord stops pulsating because it used to be that you would say you wanted delayed cord clamping, but these days delayed means 15 seconds, 30 seconds, it depends on the provider. If you say, I want it to stay attached to my child unclamped until it goes white, there's no timetable on that. It could take 30 seconds, it could take 5 minutes, but I want to make sure that my baby's getting all of the boost that she needs from that cord blood from the placenta before we cut it off of her. So that's what we're opting to do. Umbilical cord cut by my partner, which is what we did for our son. It asks, do you want the sex of the baby announced by your partner, by the staff, or do you want to find out on your own? We know what we're having, so that doesn't really, factor in for us. After delivery, do we want to deliver the placenta naturally or managed with injection? I said naturally. Are we taking the placenta with us? I'm not interested in doing that. I always said I would, and like I did encapsulate it and take it and whatever. I don't know if I'm necessarily interested in doing that anymore. So the plan right now is to not take it home. She did say that if I wanted to bring a styrofoam cooler to the hospital in case I change my mind, because if you're not prepared to take it home, they will just throw it away. So potentially I might do that, but I'm not super interested in doing all that, so I probably won't. We will not be collecting cord blood for my daughter. We did it for my son, and thousands of dollars later, I'm still paying for the storage fees because I will kick myself if the year I decide not to is the year that there's some breakthrough. But the fact is that it is impossible. It's impossible, and I'm not using that word lightly, to actually use your stored cord blood for anything unless you're part of like a university study or something like that, and that's very hard to get into. So basically, I have my son's cord blood there from birth, just sitting there, frozen, waiting to potentially be helpful to us, and we're not able to access it. So I'm not going to do the same thing to my daughter. I'd rather she get all that cord blood for herself. As far as holding baby, do I want skin to skin right away, or do I want them to wipe down my baby first? I want to feel her immediately. I want skin to skin right away, and I don't want the skin to skin to end until it absolutely must. So that's me. I plan to feed my baby by breast, expressed breast milk, or bottle. I put breast. I don't want them to give her bottles at all unless it's absolutely necessary, unless there's some emergency. I don't want her to know a bottle for several months if I can help it. And then the last category, or the last check mark, I guess, in the after delivery category is medications for baby. As advised, none, or please ask first. I put please ask first. And then there's another section here of like health info, which is where you'd let your team know if you have group B strep. I don't know if I do because they don't test for that until like, I think like week 35 or something. They haven't tested me for that. I didn't have it with my son, but that's something that you can pick up at any point. And that's something that does affect whether your child needs medication once they're born, if they're born vaginally. So left that blank, obviously, but hopefully I continue to not have that. If you have gestational diabetes, if you have herpes, if you have allergies, other conditions that could affect your birth, and also your RH compatibility, which is whether you have a negative blood type or a positive blood type. The second page is pretty much reiterating all of that, and then also like my birth history, when I gave birth, whether that was a C-section or vaginal, when that was, asking a lot of the same questions over and over again, birth positions, etc. Trying to go through it and see if there's anything we hadn't covered yet. Yeah, there's just a couple categories where we've already kind of talked about it, but they expand a little more. So if an episiotomy is suggested, I'd be happy to follow advice, only have it if absolutely necessary, or I'd rather return naturally. And again, I put I'd rather return naturally. If a cesarean looks likely, I'd be happy to follow advice, or rather try all other options until absolutely medically necessary. Guess which one I picked? If I have a cesarean, I'd like the screen to remain in place, the screen to be lowered to see the birth, a gentle cesarean if possible. That's what I selected. I'm not sure what a gentle cesarean entails, but I figure if I must have a cesarean, I would prefer it to be a gentle one. So I may have to look into that. And then the last little bit here is I'd like the umbilical cord to be cut by my partner and to remain attached for as long as possible. I'd like my baby to have skin to skin with me, have skin to skin with my partner, and latch on between 1 to 2 hours after birth, or within 1 to 2 hours after birth. The only one I didn't check there was be cleaned up soon after delivering. I really don't care about that. That's not a priority to me. And actually studies show that leaving the baby covered in vernix and just kind of like rubbing it into her skin rather than taking it off is more beneficial to her. So if anything, that's what we'll do, but I'm not interested in having her cleaned up right away. We already know the sex of the baby. I plan to feed the baby by breast, etc. So that's pretty much it. That's the 3 pages. I want to find out with my hospital, or I guess I could ask my OB, what their stance is on continuous monitoring. Because one of the things that we did with my son is the hospital that I birthed at insisted on continuous fetal monitoring rather than intermittent. The difference being that continuous obviously is the whole time you're in the hospital. They have to have something on your belly to hear the baby. Intermittent means every 10 minutes, 15 minutes, half hour, whatever everybody feels comfortable with. They'll check on the baby. Okay, baby's still good. Go on and continue laboring however you're going to labor. That first hospital insisted on continuous monitoring, and they did not want to have to keep adjusting the monitor whenever baby moved. So I ended up having to get an internal monitor, and that's literally a screw that goes up inside your person and gets embedded into your child's scalp. It's extremely painful the whole time you're wearing it, which is the entire time you're in labor. Who knows what it's doing to your child, because they don't know, they can't tell you. And it, as you can imagine, deeply, deeply impedes how you're able to labor, because now you have a giant metal thing hanging out of you. So I am willing to do literally anything and everything I can to avoid that. And so I want to know how they feel about continuous monitoring, because I would rather not. But if I must, I will insist on external monitoring only. I do not want an internal monitor. That's a deal breaker for me. So I need to find out about that as far as the hospital is concerned. But that's it. That's my birth plan based on the suggestions and preferences that my doula suggested. My doula is on board, and my husband knows all of my preferences as well. My doctor's aware of all my preferences, and she's been on board the whole time, which is one of the reasons why I selected her. So I'm feeling really good about all this going into it. And yeah, if you have any questions about this, or about a specific choice I made, or what the choice actually means. I feel like I elaborated plenty, but just in case, leave me a comment and I'll do my best either to explain in the comment or maybe even direct you to like links or resources so that you could do more research for yourself. But I feel like some people do better just saying, my plan is to show up, have a baby, and have everybody be alive at the end of it, whatever that means. I'm obviously much more type A than that, and there are a lot of choices that go into a birth. So I like to know what all of my options are and have the ability to research each and every one of those options, and based on pros and cons, decide which of those options I'd prefer to pursue. Obviously, birth plan is very loosely worded because birth is unpredictable, babies are unpredictable, and you have to be able to pivot. But even just preparing to have a birth plan, that means that you are doing this research and you are aware of what the pros and cons are to any given choice, so that if you do have to pivot and at the moment you have to decide, okay, well, plan A is not going to work, so our options are plan B or plan C, you can make an educated choice about which you'd rather do, because you've already, while you were still of sound body and mind, looked into what both plans actually mean, and you can determine what will be best for you and your family. So if nothing else, I hope that that aspect of this has been helpful for you. And yeah, thank you guys so much for watching, and we'll chat again really, really soon. Bye!